first time I experienced symptoms of aortic stenosis was probably 12 years ago, 11 or 12 years ago. And I was a regular walker, and I started noticing that it was increasingly difficult for me to get enough oxygen, particularly walking up hills. If my wife came home with a car full of groceries, I could go out and bring in one bag, and then I would have to stop and rest.
In about 1 in 20 patients over the age of 80, there is calcification, bone buildup inside that aortic valve, which is normally a very flexible and pliable structure. As that fibrosis and as the calcification becomes more severe, it deforms the valve, it makes the valve very narrow, and as a result, the contracting of the heart can no longer eject blood as it would normally.
It just made my physical life very difficult. It required a lot of sleep. If I played golf, for instance, on a hot, muggy day, I'd have to take a nap just to get through dinner.
Typically, the symptoms that patients experience when there is progressive aortic stenosis are either shortness of breath, chest pain, or actually passing out, syncopal episodes. But more importantly, a reduction in the quality of life that the patients feel. They're alive, but they just can't do the things that they want to do.
I eventually got to the point where I said, we've got to do something because I'm just not having fun anymore.
We've now developed a program that allows us to treat the patients without open heart surgery using transcatheter aortic valve replacement.
In Terry's case, he was not a candidate for surgery, and we were able to sit down with him and his wife and family and talk a little bit more about transcatheter valve for him.
This technology offers a solution to patients who otherwise would not have had an option at relieving the obstruction to their heart. So it is very revolutionary in many ways.
Since 2011, we've been developing our experience with transcatheter aortic valve replacement here at the Beth Israel Deaconess Medical Center.
We have developed what we called a heart team, which is the standard of care for developing these new transcatheter-based therapies.
I think one of the real advantages of the multidisciplinary team, cardiac surgeons, cardiologists, interventional cardiologists, geriatricians, pulmonary specialists, cardiac anesthesiologists, is that we can actually design the optimal therapy for the individual patient, because every patient has a solution, and their solutions are different.
The only way I could describe the care that I got was off the charts. They were tremendous in terms of answering questions, so I got an awful lot of good information. Certainly by the time we got around to do the surgery, I was extremely comfortable with the whole process.
We used a transfemoral approach, and we were able to position the valve just where we wanted it to relieve the stenosis.
The valve is guided with images over a wire, over a catheter, into position, and then inflated in position in the aortic valve under imaging with echocardiography as well as with fluoroscopy. Once the valve is deployed and the old valve is stretched or pushed out of position and the new valve is in place, there is an immediate relief of a very bad obstruction, and you can see the positive results of the procedure very quickly.
When I was able to get out of ICU and get back to my room, I could tell almost instantly that my breathing was more relaxed.
When we relieve the blockage, the heart's still stiff, and it has to get used to those lower pressures over time. And actually the heart muscle regresses over time. It becomes less thick and it becomes more healthy.
Over the next, say 3 or 4 months, almost every day I could see improvement. I could walk further without being tired. I could go up and down stairs. I could lift and lug as long as I was careful.
Although patients will sometimes say, I'm still a little short of breath in a month, by the time we see those same patients at 6 months, their ventricle has gone through very favorable remodeling and they're much less breathless than they were before.
I mean, still to this day, I have my limitations, but they in no way restrict my quality of life at all. I feel younger, I feel better.
One piece that we've learned, which is incredibly important as we talk about this to patients, is that the success rates are not in everybody. But from my perspective, he's one of our real success stories about how transcatheter valves have really made a huge difference.
His whole family is visibly happier. They're more engaged, they're more social, they're able to do the things that they wanted to do before, if not even more.
The future for me is certainly an awful lot brighter than it was. I'm ready to face whatever life brings me. Literally has given me my life back.